So one of the questions that we know our guests are going to be really curious about, and Becca and I are too, is your mindset in surgery. And actually, when you're in there, when you've got the gunshot patient coming in or the stab patient, coming in, what is your mindset and how do you handle what is life and death decisions day to day?
I think overall, in terms of mindset, I think some of it for me is approach, which is my entire goal is to very quickly figure out who needs surgery, who's dying, what surgery do they need, and how quickly can I get them up to the operating room. And when we talk about this, we're talking about this gets decided oftentimes in under 10 minutes. In patients who have been traumatically injured, if you spend longer than 10 minutes in the emergency department, which is a place of triage, really, it's not a place of treatment for trauma patients, your mortality starts to go up. So I like to say I love jigsaw puzzles because I do. And it's literally the ultimate jigsaw puzzle with a time clock ticking with pieces that you can't necessarily see the colors of, in the sense of you have zero or very limited information. You're trying to get as much information as quickly as possible in an organized manner. And I think really the skill set for that is maintaining calm, maintaining focus so that you can be efficient. Efficient is fast. It's not necessarily about just being fast. It's about knowing what you need to figure out, how to get that done as quickly as possible, and then quickly making a decision on it. So I think the biggest thing for me is, I tell my residents, I tell them, your job is ice water over everybody in the room. We're not going to have lots of words, but every word's going to matter. We're going to have direct, calm communication, and we're going to get it figured out, and we're going to get it taken care of. I think some of that, now that I say it, I think some of it definitely plays into, in those types of situations, it goes back to you don't always know what to do, but you have to know what you're doing. And I think being able to portray that puts people at ease. When it's like, okay, we'll figure it out. I mean, that's literally what my job is. There's a hole somewhere. We'll fix it. We'll find it. And I think portraying that internally and externally is what gives you a mindset or a framework for not just when a patient comes in that's been shot, but when you feel overwhelmed, when, you haven't gone to the grocery store, your gas tank is on empty, you forgot your kid's supposed to dress up like it's 1980s day at school, or hypothetically their parent-teacher conference, which I've done before. When you start to feel overwhelmed, I think it's being able to take that breath and say, okay, we'll figure it out. I'm not exactly sure how it's going to look, not exactly sure how it's going to go, but I know that it is going to go. And I know that we are going to address it and fix it. And whether the fixing means success in terms of a patient living, whether the fixing means, that I'm going to home bake some cookies for that bake sale, or just go to Kroger and throw it in a Tupperware and try and pretend like I can bake like that. I think it's trying to take the focus. I think we focus so much on how things are supposed to go rather than what the end result really should be, which is taking care of patients, having my children feel loved, and having yourself feel loved.